The Spanish influenza, commonly referred to as the Spanish flu, made its appearance in Jamaica during the last quarter of the year 1918. The disease appeared in Port Antonio and then Montego Bay following the docking of banana boats from North American ports in mid-September 1918. By early October, the island was faced with an epidemic which moved with deadly speed at a time when the world powers were at war. The island was unprepared and ill-equipped to deal with the disease and could offer no effective way to combat the spread or its cure. The management of the Spanish influenza epidemic was controlled at the local level by the parochial boards in each parish. In this regard, they requested loans from the government to erect isolation hospitals and pay the traveling claims of medical officers. The Central Board of Health, with the approval of the governor, prepared and distributed to all parochial boards a leaflet outlining the measures to be taken to prevent the spread of the disease. The Spanish influenza was described as an acute infective disorder characterized by fever, headache, and joint pains, accompanied by a cough and nasal discharge, and in some instances, pneumonia. The measures for prevention included the wearing of masks, isolation, disinfection, and the segregation of the sick from the healthy. In addition to the leaflet, the Central Board of Health recommended the fumigation of railway carriages and closing of theaters and other public places to avoid the spreading of the disease. All public elementary schools were closed by order of the governor, and a reported 83% of schools across the island remained closed for about 2 months. With the closure of schools, school examinations were postponed and in some cases excused altogether, as some schoolrooms were converted into temporary hospitals. Before any school was reopened, approval was required from the medical officer of health or the local board of health. All parishes were affected, with the exception of Port Royal, which reported 1 death from the disease. According to the Superintendent Inspector of Health, there was an estimated 70,000 cases of the disease on the island, with a registered 5,022 deaths at the end of December 1918. Of these casualties, 2,702 were individuals between 20 and 45 years, and 1,150 children under 5 years. The East Indian community was not spared by the disease. It was reported in 1919 that 75 indentured immigrants and 329 non-indentured immigrants died from the Spanish flu, leaving behind 37 East Indian children in the care of the Immigration Department. By the end of the financial year in March 1919, there were no reports of the disease. It had disappeared with the same suddenness with which it appeared in October 1918. The question we are left to ponder is, what lessons can we learn from the Spanish influenza as we face a similar epidemic today, COVID-19? Let us make use of these records from the past to guide our present decisions and empower our society.